Hey guys, it's Kelby Hightower of Medicare Monday for Seniors. Hope you guys are doing well. Hope you're having a great week and looking forward to a great week in front of you. Today we're going to be talking about Vision and Hearing Ancillary. It's kind of the ending of our series of ancillary products that we've covered over the last few weeks. We've covered hospital indemnity and then cancer policies or cancer riders that can go along with hospital indemnities, why those are so important to have with Medicare Advantage plans, and then dental insurance. Regardless of what type of plan you're on, if you are not insured enough, dental plans are a vital part of having care and having good hygiene, which can help your health and improve your health. And having your teeth, it statistically shows that you're able to eat and get the nourishment that your body needs to sustain livable, ongoing health. And dental insurance can be pretty inexpensive unless you have somebody that doesn't really know what they're doing when it comes to helping you choose a dental plan, and then they can a lot of times steer you towards a plan that I would encourage you not to go on. The other benefit about dental is a lot of the policies we insure, if they're written by the 15th of the month, they can go into effect the upcoming 1st of the month. If they're written after the 15th, they go to the subsequent month on the 1st. But the good thing about that is dental, if you have comprehensive care outside of a toothache that needs to be addressed right away, sometimes it's something like a root canal and it can be put off for a couple months. You can actually pick a dental policy up that doesn't have waiting periods. So that's another big attribute of things that we cover with people. Do you want a plan that has waiting periods or no waiting periods? Well, guess what? If I have something that happens in the first year and I have a waiting period and the insurance won't pay for it, it's kind of useless insurance. If I have a policy that has more flexibility, it doesn't have waiting periods, guess what? I can have the continuity of care or the quality of care I need at the expense of just buying the policy and having it go into effect. So let's cover vision and hearing and make it very simple. Vision insurance. So there are carriers out there like the BSP that you can actually have for employer or standalone plans that are inexpensive enough to justify buying a policy for vision. Most of the time though, if you're paying $30 or $40 a month for an insurance policy for vision, and you're like me, I wear readers. I actually have one eye that's weaker than the other eye, so I have to actually have a prescription strength glasses for readers, but I have great vision far off. I have to have something for the computer or books and when I'm reading. So I wear readers all the time now. And I actually have to pay for those, and they usually cost me, I'll usually shop at like Vision Works, and I go in there and choose one of the frames that are available, and usually I try to find something on the sales rack for about 50% off, and I usually spend out the door about $150. Now this last time I put the blue lens in that allows the exposure of blue light that comes off computer screens, and I added another $30 or $40. But let's say $200. Well, if I am insuring myself with a vision policy for $30 a month or $25 a month times 12, 300 is $360. I go get my eyes examined for $50, and then I buy a $200 pair of glasses. That's $200 I've spent that year. Well, the last time I was in getting my eyes checked was 2018 or 2019. I got my first set of readers then, 2018. So it's been almost 4 years later, and I had a new prescription prescribed and new frames. So I would be paying $30, $360 times 4, and I've got my eyes checked 2 times. Well, that's well over $1,200. Why would I pay $1,200 in premium to insure an out-of-pocket of $500? I wouldn't do that. I would have a piggy bank or a jar, and I could just stick a few dollars in there every month, build up, and then when I need to get my eyes checked, I pay $40 or $50. Then I buy my glasses out of pocket, because the insurance, you're paying more in premium than you get back in benefit. Now, this poses a question that a lot of times people ask. They say, well, I have prescription strength glasses that are $600 or $800. Well, you need to do the math. You need to take the premium times 12 equals, and then know what the benefit of the plan is and determine whether or not it's affordable for you to even go on that insurance. Hearing benefits, a lot of times if you're buying a dental, vision, and hearing plan, it's an all-encompassing plan that you pay a premium each month. The hearing aid benefit or hearing benefit on that usually is going to pay towards a hearing aid. Sometimes it covers up to a certain dollar amount, or it covers a certain percentage amount. And again, if you're just getting a hearing policy. Typically you wouldn't buy a hearing policy like that. You would buy one that encompasses dental, hearing, and vision. We have found that with those plans, they have time limitations or waiting periods. Sometimes the hearing benefit is not as great on those plans. Sometimes the vision benefits. What we've really come down to is simplifying it, saying have a dental policy, save your cash. If you're on a Medicare Advantage plan, choose a Medicare Advantage plan that covers your hearing aid benefit. If you're not on a Medicare Advantage plan and you're on a regular Medicare and a Medicare supplement and you need a hearing aid benefit, make sure you're shopping the plans correctly. There's a ton of different plans out there, and a lot of times people are selling you a higher premium plan and it doesn't really justify the benefit. So I'll leave you with this example. If I were to give you, if you were to say, Kelby, I want to invest 50 cents into you, what would you give me back in return? And you gave me 50 cents, 2 quarters. And I turned around and said, you know what, I'm going to give you $1 back for those 2 quarters that you gave me. That would be a wise investment. Now, if you said, I'm going to give you $1, and what investment am I going to give back to you? And I give you back 50 cents, well, guess what? You have lost money. So insurance works the same way. Do not overinsure or pay higher premium with less benefit. Pay lower premium for more benefit. There's products out there that'll serve you well if you have somebody like us or myself that's an expert in the subject matter and it's able to look at your situation in a comprehensive way. If you have a question, guys, and you're looking at trying to pick up an ancillary product and you're confused about all the different options, give us a call. But if not, we will see you next week on Medicare Monday. You guys have a great week. We'll talk to you soon.